How does medical ingenuity help in extreme survival injuries? Imagine being miles away from help, with only what you have on hand, and facing a serious injury. That's where medical ingenuity becomes your best friend. It's all about using your knowledge and creativity to solve problems when resources are limited. In survival situations, knowing how to think outside the box can save lives. When professional medical care isn't nearby, you need to rely on basic medical supplies and your ability to improvise. For example, if someone breaks a bone and you don't have a proper splint, you can use sturdy sticks and clothing. Wrap the cloth around the stick and the limb to keep it stable. This helps reduce pain and prevents further damage. If you're bleeding heavily, applying direct pressure with a clean cloth or even a piece of clothing can slow the blood flow. Elevating the injured limb can also help control bleeding. Sometimes, you might need to make a tourniquet from a belt or a piece of cloth, but only if bleeding is life-threatening. To prevent infection, clean wounds with the cleanest water you can find and cover them with a sterile or as clean as possible material. Managing shock is also vital. Keep the person warm with clothing or blankets and encourage them to stay calm. If someone is unconscious and not breathing, basic airway management becomes critical. You can tilt their head back slightly to open the airway and check for breathing. In extreme cases, you might need to perform rescue breathing or chest compressions. History shows us how resourceful people have been in dire situations. During Antarctic expeditions, doctors used boiling water to sterilize tools and performed amputations with basic instruments. They also improvised anesthesia with available substances. Modern techniques like extracorporeal membrane oxygenation, which circulates blood outside the body, are advanced examples of how ingenuity can save lives even in the harshest environments. But remember, improvised solutions are temporary. They buy you time but are not substitutes for professional medical treatment. The goal is to stabilize the injury, prevent complications, and get help as soon as possible. Building your survival medical skills involves learning first aid, practicing improvisation, and understanding how the body reacts to injuries and environmental stresses. The more you practice, the more confident you'll be in applying these skills when it counts. Staying calm, assessing the situation quickly, and using what you have creatively can make all the difference. In the end, medical ingenuity is about turning limited resources into effective solutions, helping you survive and protect others when every second counts.